I'm Ramsay Kuo. I'm a urologist with the First Physicians Group. When I'm treating patients with kidney stones, they usually see me with a very significant event where they're having a lot of pain, come to the emergency room, and that's where we establish a relationship. They're obviously very keen on getting their issue treated. A stone can present as a small 5 millimeter focus that drops into the kidney tube or the ureter that drains the kidney. And that's usually how someone presents, is that they start having a lot of pain and discomfort because the stone is blocking the urine from getting from the kidney into the bladder. Sometimes stone material can actually fill up most of the inside of the kidney and branch out into these peripheral areas, and that's where you have to have the expertise and the ability to make a keyhole incision from the patient's flank or the back, just to go into the kidney directly and use a slightly larger telescope to minimally invasively treat these very large and complex stone burdens, but in a way that will allow you to clear this massive amount of stone, hopefully in one setting, which is the goal, and be able to get the patient out the next day. Once the stone is treated, after we talk about the most appropriate intervention, what happens then is really being able to have a back and forth about how to best prevent stones, and really establishing that long-term relationship is a very rewarding part of the job, because having them get to a point where they have fewer stone events and are doing very well is really the most rewarding part of the job.